Metro Malik here at the Child and Family Charities open house and tour of the nonprofit hub. I'm here with Sarah Laurie of Community Mental Health that serves Clinton, Eaton, and Ingham County. I messed up your title. What do you do? You're the
Chief Executive Officer.
Oh, the Chief CEO.
Yeah.
What is it like to be in charge of that type of organization?
It is very humbling and a distinct honor for me to serve the community in this capacity. The mission of the organization is so vital, and we truly are woven into the fabric of the community.
Without putting you on the spot, I'm not going to ask you to recite the mission statement, but what is the goal of community mental health and connectivity to the community?
Well, historically, we are the public behavioral health provider for Clinton, Eaton, and Ingham counties. And so our role under the mental health code is to serve severe youth with severe, serious emotional disturbance, development. That's the core. We provide a number of specialty services. And on top of that, though, we have become a certified community behavioral health clinic. So that is so a wide range of resources available to anyone in the community. So we're basically serving from birth all the way through somebody's life with many, many different services.
So if somebody knows somebody that could use services, how will they find out more information?
Best way is to call our access center, and that's 517-618. If it's a crisis, we have 24/7 crisis services available, walk-in services over on Jolly Road, mobile crisis capabilities, and that number is 346-846.
And that Jolly Road facility, is that in between Pennsylvania and Cedar?
Yep, exactly.
On the south side of the road?
We are, though, currently in development on this campus in the former Women's and Children's Building, which is on the southeast portion of this campus, developing the Crisis Care Center. So
you just made my job easier because I was going to segue. What is your connection to the Child and Family Charities nonprofit hub if you have a direct connection? So that's part of it.
That's part of it.
Yes.
And in anticipation of that, we have some of our programs currently housed in the hub.
Okay.
We were one of the first occupants of this building. So it's been exciting to see the development and all the other resources move in. But yes, the proximity both to Child and Family Charities, but also to our new facility, our Crisis Care Center, is perfect.
Can you briefly describe the Crisis Care Center and what type of services and amenities that would have that serve the public?
I'd love. So right now we have the 24/7 walk-in services, Jolly Road, and our youth services are in the Human Services building. This building will allow us to reposition our currently existing walk-in crisis services, one side youth, one side adults. We're also going to move over the Recovery Center, which is our 24/7 withdrawal management program, and Bridges Crisis Unit, which is a short-term crisis residential. The new thing we're adding on the middle floor is a crisis stabilization unit. So there'll be a youth unit and adult unit, and that is what will fill existing gaps in the community. So it's going to allow us to safely and securely hold an individual and start care immediately for up to 72 hours. So they'll have access to psychiatry and nursing and health therapists and peers. And we're really hoping that that resource will reduce the amount of people who are seeking care in emergency departments during a behavioral health crisis where they get stuck because It's very hard to find psychiatric beds, and that environment in itself, we all know, is not really conducive to a behavioral health crisis.
I,
So,
so this is one of those opportunities where I kind of lose my. I'm like, I'm supposed to be interviewing, but I'm fascinated by this, and and in the most positive sense, because it's apparent that you're filling a need that is already there, and you've done so, but you're filling a void as well. And then I'm assuming with it all being in one space, you'll be able to have those resources all being able to work together. But it's also, I don't know the word right now, but you're dealing with all levels. And if somebody is transitioning to another spot, they don't have to go to another place. They're in the same space. Is there a best guesstimate of when this will be open?
well, we
I'm
hope-
not gonna hold. This isn't a test, so just give me a roundabout,
Appreciate it.
like month-ish.
We hope the actual building will be completed by March, and then I would hope we'll be able to open next summer.
Okay, so sometime in 2026,
Yes.
we'll be able to have this. And how many people do you think you will be able to see in that space at, and I don't know what time frame you want to use in a given time or at a given time at a day or over a course of time? How would you like, however you want to answer that?
Well, I mean, we will have greater capacity even for our walk-in services
Mm-hmm.
than we have now. But what we're adding with the crisis stabilization unit, there will be 8 youth beds side and 13 adult beds.
Okay.
And so I am imagining that we will be turning those over and keeping them full, because right now we are hospitalizing too many people, and they have to go far away outside of our community. And so it would try to keep people in the community, get them connected to our other specialty services or to other services in the community, hopefully stabilized. That won't work for everyone. We still need psychiatric hospital
Yeah.
beds, but we're hoping and take care of a portion that right now kind of seems to get stuck in emergency
So
departments or in jail.
Oh yeah. So coincidentally, as the Child and Family Charities Hub is bringing organizations together in a redundant hub, you're able to bring your services together in your own hub per se, and being able to help people, and then be able to have them close in proximity to the outside services that hopefully they will soon be able to utilize. Man, this was such a great idea.
Yeah. I mean, a great example is we already do have pretty close ties with NAMI Lansing.
Mm-hmm.
And so to be able to connect people, families, and individuals to their supportive services by just down the block in
Right.
this building is
So, with what you've seen so far, what is something that you can imagine will be a great benefit for your role in community mental health?
with the hub.
Mm-hmm.
I think just really the opportunity to collaborate with other providers. I mean, not reinvent the wheel.
Mm-hmm.
We can do more together. So, and proximity makes a difference.
That is fantastic. Well, I appreciate your time, and I gotta say this: I can't imagine that your job is not stressful. So the fact that you choose to be in this profession with this taxing as I can imagine it to be on the outside. Thank you very much for being a part of such a positive entity in our community. Thank you for that.
Thank you very much. But it really is staff at CMH that are providing care
Yeah.
for the community that are the
Well,
real
it's got to be
heroes
led
here.
by somebody. Take the count.
Thank you.
And thank you for being here, and thank you for sharing part of your story with me. I got to take care of some business for a moment. The HAMP Business Coaching helps business owners focus on what matters most, identifying priorities, building accountability, and tracking progress. Through our proven weekly coaching sessions, we make sure your plans turn into results. At Exit Factor, they also prepare you for your future. You'll learn how to value your business, create a smart exit strategy, and increase your company's worth. The reality is only 20% of businesses listed for sale ever sell. Most fail because financials aren't in order, processes aren't documented, or the business can't run without the owner. Don't let that happen to you. With HAMP Business Coaching and Exit Factor, you'll grow stronger today and be ready for tomorrow.